Hi, this is Carissa Caramanis O&rsquo coming to you from the National EMS Culture of Safety Strategy Conference in Arlington, Virginia. I'm here with Ted Delbridge from the National Association of EMS Physicians. Welcome, Ted.
Thank you.
So tell me a little bit about the association, if you would.
The National Association of EMS Physicians started a little more than 25 years ago. It was a group of physicians who concentrated their professional efforts on improving the quality of emergency medical services in the United States. Since then, it's grown into a group of physicians and other professionals who aspire to foster excellence in out-of-hospital emergency care.
So a great deal of that effort to improve and excel in the field, I'm certain, is probably focused on safety, correct?
Yep, and it does that through a combination of things. One, by education. Two, by trying to establish standards or protocols, not so much for use in the field, but standards that define, I think, the effort across the country and throughout the world, actually.
So why was it important for you to be here this week? I know you had a role on the steering committee and helped to guide some of the discussions that happened the last day and a half.
You know, once upon a time I was a firefighter and a medic, and I had to stop doing that. I was going to kill myself. I realized I was safer in a different environment, and so I think calling on that past and realizing all that we count on EMS professionals to do every day really doesn't put them in a safe environment, and we count on them for that. And so this is, I think, just part of me and my own fabric, trying to impart some safety consciousness on the part of the people that we put out in the field every single day.
Very good. So speaking of some of the breakout conversations, was there anything that really resonated with you or a key learning that you're taking out of this?
Oh, a couple of things. I think one is we all recognize that what I just said is true, in the sense that we count on people every day to strap an ambulance on their backs and go faster than they ought to go and do places that we wouldn't ordinarily go ourselves, and do things and encounter people who we wouldn't necessarily want to encounter, or things that we wouldn't want to do, and we rely on people for just that. And I think we recognize that safety probably in our core values probably isn't as high on the list as it ought to be. I think that's one. I think two, this is complicated stuff. If we were an airline, we would concentrate on certain operational things and safety of the crew, things like that. If we were just talking about firefighters, for example, most of the context of the discussion would be about firefighter safety, but we have to include the safety of personnel, and so we're interested in their well-being and their own safe practices. We have to count on the safety of the patients that we encounter. And in hospital environments, that is a whole focused effort just on that. And we have to include that in what we do. And then we have to be concerned about the public that we encounter along the way, who aren't necessarily our patients, but who we potentially influence by our actions. And so this is a hugely broad topic. It's incredibly important. It's very difficult stuff in that, again, other people, other disciplines have the luxury of just picking out their little piece, and we don't have that luxury. We are so all-encompassing.
Yeah, that's a really good point, that we have to factor in both the environment as well as the provider and the patient. It's a lot of work to be done, but excited at this really smart start, and as I'm sure you are as well.
Well, hopefully it means there's a lot of low-hanging fruit, so there's opportunity to do meaningful things quickly, and I guess get people to catch the fever, so to speak, because I think that's our largest. That is the largest hurdle, the biggest uphill climb is. Finding a way to weave the safety consciousness into the fabric of the things that we do. And the way to do that is really to get people fired up, to ignite their passions for safety, and to enable them to see how it really helps them do their jobs well, as opposed to be some encumbrance.
Absolutely. Well, thank you so much for your insights today and for being a part of these conversations. We appreciate it.
Well, you're very welcome. Thank you.
Again, this is Carissa Caramanis O&rsquo coming to you from the National EMS Culture of Safety Strategy Conference in Arlington, Virginia.